It's a rare illness affecting children and potentially related to COVID-19. While in Canada, the majority of COVID-19 cases in kids are mild, doctors are now paying closer attention to this mysterious disease, tracking the number of cases across the country, especially as provinces explore reopening schools and daycares. It's being described by the World Health Organization as multi-system inflammatory syndrome in children, or MIS-C, though its connection to COVID-19 is still unclear.
There are some children who've tested positive for the virus and some who haven't.
Doctors around the globe are still attempting to come up with a clear case definition. Right now, symptoms include a rash, persistent fever, red eyes, abdominal pain, nausea, and diarrhea. It is similar to what doctors typically identify as Kawasaki disease and presents itself after the child is no longer harboring the virus. Dr. Stephen Friedman at the University of Calgary is currently heading a global study on COVID-19 infection in children.
Each country as well has numerous registries that are trying to collect data on it. Because Canada, all in all, has had very few cases of severe disease in children, the most of them have happened in Montreal, where the greatest number of COVID-19 cases have occurred. We don't actually have a lot of children who would fit this definition. Although now that we are much more aware of it, we're starting to look back and say, okay, did we have children who we diagnosed with Kawasaki disease who may have fit these criteria as well?
Current trends suggest that cases of the illness tend to follow the peak of COVID-19 infections by about 4 weeks, meaning here in Ontario, doctors are expecting more children may present with the illness soon.
I think it is possible that in the next week or two we will see a few cases. I think that's not unlikely. But as I mentioned, as long as I think we are on the alert for it and we're keeping a close eye open for it, if the children come for medical attention, then the treatment usually, as I say, they respond well. So even if there are some cases, I would be pretty confident that that would be quite manageable.
Ontario's Health Minister Christine Elliott confirmed last week that the province is actively monitoring the number of MIS-C cases in the province. Doctors stressed to parents that if their child is ill and showing any of these symptoms, it is safe and recommended to bring them to their local emergency department. In Toronto, Natividad, City News.